Hi, so I am here with Simone Holman, who is the clinical matron for AAU and ACU. And Simone has bid for a cardiac telemetry monitoring system. It costs a little over £47,000. And so, Simone, what I want to ask you was, firstly, how does this equipment improve your department?
So the equipment would massively improve patient experience on both our inpatient acute assessment unit and our ambulatory unit. It would mean that mobile patients can keep their mobility while still ensuring they get the cardiac monitoring they need. So currently these patients are restricted to being on their beds or their chairs if they need cardiac monitoring. But if we were successful and we were able to get this equipment, it means people would keep their independence. They'd be able to shower, they'd be able to use the bathroom, they'd be able to move to other bed spaces and around the ward.
Which they can't currently do.
Yeah.
And that this equipment completely changes their experience. Does that mean that you'll be able to see a lot more patients on a daily basis or monthly, weekly? Does it allow you to have a lot more put through in terms of, patient care and what have you?
So from an ambulatory care perspective, it certainly would. So the aim of the ambulatory care unit is to get people inpatient treatment through an outpatient environment. And there are many patients that come through the ambulatory care unit that need infusions of medications. At the moment, they would have to be admitted to inpatient medical wards because they would need to have cardiac monitoring, and that's not something that we can offer in our ambulatory unit. However, if we were successful, these patients could come to hospital, have their treatment for 4 to 6 hours and then be discharged home, which would reduce the need for them to be admitted.
And the question that we always get asked about from the charity perspective is, why can't this equipment be bought by the NHS? So
I think you
is there a
summed that
simple
up
answer?
really nicely at the beginning, because it's a little over £47,000.
Right, okay. So, but I mean, obviously the NHS does buy stuff, so is this just seen as a luxury item, or is it, a nice to have rather than a need to have? How does that?
So in terms of life-saving equipment, it's not as advanced as some of the things that the NHS would fund. From a patient experience, from a reduced length of stay, for actually being able to capture patients when they have their cardiac arrhythmias, I think it's hugely beneficial. It's just not life-saving.
Okay. And I mean, we're creating individual pitches on our website for all the different items we're going to try and fund in 2020. If you had 30-second elevator pitch to donors to finance this equipment, what's the kind of key message you want to put out there?
So essentially, look at it from a patient experience. If you come into hospital and you currently need cardiac monitoring, you are restricted to your bed and to your chair. Actually, that takes away the independence of our older population, and also it means that our young patients aren't able to socialise with their friends, they can't sit in our communal areas, they can't go to the shop if they want to, they are literally restricted. That takes away privacy, dignity, because it means they have to use commodes or bedpans, and actually the aim of getting people in and out of hospital is to do it as safely as possible. If you're an elderly person, you come into hospital and you need cardiac monitoring on our units, you have to stay on your bed. That therefore means you need therapy assessments to get your mobility back to scratch before you leave the hospital. So that means you have to stay with us longer.
Cool. Well, look, if you're watching this video, that means you've clicked onto the campaign to hear more. If you like what Simone's been saying and you want to support this particular appeal, there's a donate button on this link, so just click it, and the money that you donate will go directly to Simone and her team.
Thank you very much.